Hi, it's Amy Klingler from the Salmon River Clinic in Stanley, Idaho, back now to talk about helping your patients navigate through a diagnosis of mild cognitive impairment. So when patients first get the news that they may have a diagnosis of mild cognitive impairment or Alzheimer's disease, they can have a whole range of responses. Some of them want to take action immediately, some of them have a lot of fear, and so it's important to be prepared for all of that. Sometimes I like patients to come back for another visit after we've given them the diagnosis. Similar to how when you give a patient a diagnosis of cancer, they need time to digest that diagnosis before they can really take in any more information. So some patients may immediately start thinking about their financial situation. They may think about long-term care. They may think about all different aspects of their health and their partner's health. They may actively want someone involved, and that's an opportunity to bring a care partner into the exam room with the patient, so there's two sets of ears hearing what you're saying. Always when you're talking with patients, you want to provide information succinctly, you want to provide it in language that they can understand, and you want to make sure that you're giving them things that they can do, actionable items, so that they feel like they're in control of this diagnosis rather than this diagnosis being in control of them. This is an opportunity to talk about their whole health, because we know that what's good for the heart is good for the brain, and so there's an opportunity to take care of other cardiovascular risk factors, blood pressure, hypertension, lipid disease, thyroid disease, vitamin deficiency, and most importantly, hearing and vision. There's a lot of opportunity to refer patients for hearing and vision exams when you express concern about mild cognitive impairment. Some patients may be convinced that with a diagnosis of mild cognitive impairment that they're already on the road to Alzheimer's disease. And it's important to remind them that really only 1 to 2 out of 10 patients with mild cognitive impairment progress to Alzheimer's disease each year. So the diagnosis really may be a slower progression than some patients may assume. So it's important to give them that information so they can understand where they are in the disease process. Primary care PAs can help facilitate referrals and really be the home base for patients when they have a diagnosis of mild cognitive impairment. You may be referring them to geriatrics, to neurology. You may be sending them for imaging tests or blood tests, and it's really great that they have their primary care PA to be their home base. So what I really want you to get out of this video is the importance of being prepared for any type of reaction that your patients may have. They may be distressed, they may be uncomfortable, they may really be worried about their independence, but if you can meet them where they are and give them actionable items that they can do for their health, they'll feel more in control. Stay tuned for the next video when we talk about stages of Alzheimer's disease and progression.